Welcome back to Fox 51 today. Dr. Ray Kumar with Trinity Clinic Cardiology has some great information for us today. It's about this stent for your leg. He says it's very helpful.
Yes.
He's going to tell us a little bit more. Dr. Kumar, tell us about this leg stent. You were telling us about it during the break. It sounds like it's a great idea. Could you give us a little bit more information?
Sure. When people have blockages in the legs, typically they have pain in the back of their legs when they walk. And this can be debilitating. In severe forms, you can even have amputations.
Wow.
Typically, this is seen in diabetic patients and people that smoke. And the treatment now is to put the stents in the arteries to reopen the arteries. And we have those stents for the last 10 years. But the problem, and really the Achilles heel, is that these stents re-narrow because of the scar tissue that forms within the stents. The new stent, the Zilver PTX stent, has a special drug on it that prevents the re-narrowing, and so the stents stay open and allowing persistent blood flow down the leg, and it's really a revolution in the field.
Wow.
I guess back in the older days, were people treated more just with blood thinners primarily?
Well,
How
yeah.
has that changed?
Blood thinners and actually open bypass surgery, and you're in the hospital for a long time, you have a lot of pain, you can have some complications there, and so now you come in, I'll take it to the cath lab, put a wire there, put the stent in there, and you go home the same day.
Wow.
So it's really a revolution in treatment.
Now, who would be the prime candidate to get one of these leg stents?
So people that, older patients with diabetes, particularly if you smoke, and when you're walking you get tightness or heaviness or tiredness in the backs of your legs when you walk, those are the patients that should be concerned that they may have blockages in the legs. And as a cardiologist, I'm also worried about blockages in the heart. And most of the time, if you have blockages in the legs, you also have blockages in the heart, and you really need to see medical attention if you have any of those feelings of chest pain or leg pains or tightness when you're walking.
Now, the dangers of the blockage, just review that for everyone there. Obviously, I know there's some different things that can happen to the body, right? Where
Absolutely.
Are those?
Well, in the heart, if you have blockages, you can have chest pains and shortness of breath, or you can have even heart attacks. So you have to live a clean and healthy lifestyle. And in the legs, if you have the blockages, you're going to have pains and tightness when you're walking. And even in severe forms, you may require amputations if it gets really bad. So really, the treatment strategy is medical therapy with lipid-lowering medications like statins, cholesterol medications, stopping smoking, getting your diabetes under control, and coming to see a cardiologist or a doctor.
Well, I mean, now say we wanted to see one of the cardiologists at Trinity Mother Frances. Is there some sort of website that we can find more information about? Yeah,
the Trinity Clinic Cardiology website is there. We're at the new Lewis and Peaches Owens Heart Hospital. We're open. We're helping the people here. We have a lot of open spots, so we're happy.
Well, it sounds like you need to step on by if you think that would be something you'd be interested in. Thank you so much for stopping by this morning.
Thank you.
Coming